Paramedics do not get enough training to prevent medical errors. A Hamilton court heard that today. A professor of emergency medicine testified at the trial of two former paramedics charged with failing to provide proper care to Yosif Al-Hasnawi. Lisa Hepfner, has the latest.
Medical errors are the third leading cause of death after cancer and heart disease, according to an emergency medicine expert testifying today, called by the lawyer representing Christopher Marchant, seen here in the red tie, who, along with Stephen Snively in the hat, is on trial for failing to provide the necessaries of life to 19-year-old Yosif Al-Hasnawi, who had been shot with a .22 caliber bullet on December 2, 2017. The paramedics called to help him thought he had been hit by a BB from a pellet gun. That notion became a bias that paramedics couldn't shake, and they were shocked when Al-Hasnawi died of blood loss. But according to Dr. Pat Crosscarry, paramedics aren't taught to recognize biases that affect decision-making, which can be dangerous. You may become a victim of it, or your patient may become a victim of it, he told the court. The paramedics heard pellet gun from dispatchers. They heard the same on scene. And Al-Hasnawi's wound looked like a little BB blister, according to their testimony. Other first responders latched onto the idea, and groupthink took over. When Al-Hasnawi started flailing about, they didn't realize it was because of internal bleeding and a lack of oxygen to his brain. They thought he was acting. They didn't have the training to look for factors to disprove their bias. Right up to the end, they believed it was a psychiatric problem, Crosscarry told the court. His testimony resumes tomorrow. Lisa Hepfner, CHCH News.